blogger and creator of the blog Miss Right Says, as well as OMG OBGYN. I wanted to introduce all of our panelists, and then each one of them are going to give a little bit more background about who they are and what they do. So to my immediate right, I have Miss Salena Collins.
Hi.
Salena is the owner and founder of Clear Gardens Yoga Studio. I have Dr. Lisa Upshaw, and many of you know her probably already as Dr. Lisa. And Dr. Lisa is a chiropractor as well as a holistic health practitioner who specializes in acupuncture and functional nutrition, something that I think we all definitely need. To her right is Dr. Melissa Natavio, and she is the Director of Family Planning Fellowship, and she's also an assistant professor for the Department of Obstetrics and Gynecology at the Keck School of Medicine at USC. And last but not least, we have Ms. Lauren Cornell, and Lauren is a registered dietitian. And one of the #1 topics that kept coming up, no surprise, is fibroids. One of the questions that came up is, well, what are they? What are fibroids? They're pesky. They're obviously sometimes, very serious for some patients. And then, what are the treatments for them? And so I wanted to pose that question to our two physicians on the panel first.
All right, so can you hear me? Is it still on? Okay. Is it still on? Okay. All right, so fibroids are smooth muscle tumors of the uterus. So the majority of the uterus is a smooth muscle, and so there's a proliferation of one type of cell in the uterus, and it forms a benign tumor that is called a fibroid. They can be located in different areas on the outside of the uterus, in the wall of the uterus, or even inside the uterine cavity. And they're very common. Half of women have them. And of those women, half of them may have symptoms. And so depending on the location and the size, it may cause different types of symptoms, whether it's pressure, abnormal bleeding, back pain, or even pushing on your bladder and causing you to go to the bathroom a lot. And so I encounter this very frequently, and it could range from people having such heavy bleeding that they become anemic and need a blood transfusion, or need medical treatment where it can just kind of regulate their cycles, or even some an NSAID or a pain reliever to help with the pressure-like symptoms. Sometimes they can get so large, and at the county we see women who don't have access to care as readily, and it looks like they are about 9 months pregnant. And so in those situations, with the pressure and the discomfort from that, then we would recommend surgical removal of those. So the treatments range depending on what the symptoms are, and not everyone who has fibroids will necessarily have symptoms from it. I don't know if anyone has any specific questions that you'd like to address. Yeah.
Is there anything that you can do to lessen the size of them?
Unfortunately, not that I know of in terms of allopathic medicine. There is one shot, a type of medication you can give to help with shrinking the fibroids, but that's typically when the fibroids have reached a size and cause a lot of bleeding, that it kind of stops the bleeding, and then it helps shrink it down for a little bit, but it's just temporary before bringing someone for surgery. Yes.
Is there any correlation to what, or a connection that you know of what is feeding the fibroids? Like, is it hormone based? Is it people who tend to have higher levels of estrogen or progesterone have more of an issue with this? I'm just curious because I suffered from severe endometriosis and had 2 surgeries there, but I've never had issues with fibroids. So I'm curious as to, I know that my menstrual cycle and the estrogen and all those things will feed the endometriosis to grow and get out of control, but then I'm curious what maybe causes the fibroids and is really kind of the source of that and what's feeding it, or causes maybe for them to be worse with some people than others.
That's a very good question. It is hormonally responsive to estrogens and progesterone, but mostly to the progesterone type of hormones. There may be other things like dietary things that can also feed it, but there are some treatments that are kind of being looked at where it's a progesterone receptor blocker, and what it does is cause shrinkage of that. But we aren't at the point where it's used, on a very common everyday basis. So in the meantime, it's kind of one of those things we don't know exactly what it is. And we do know that taking oral contraceptive pills or other type of hormonal contraception can help with regulating cycles and if someone has irregular periods from it. But in terms of, we don't have any information that the hormones from those that are on the market actually feed the fibroids. So they're safe to use in terms of that.
And the opposite, I guess, if you shut down your system and
That's right.
with, if you take a 5-year Norplant or something where you're not having this, well, that's different. I'm trying to think of something more like a Depo-Provera or something that's really shutting down your cycle. Has that proven to help? Do you know if that has any effect?
Like slowing the growth? I don't know if there are any good studies to demonstrate, like head-to-head, that this is doing better in terms of shrinking fibroids or, slowing the growth, because everyone's fibroids can grow at a different rate. So I think, in terms of studying it, in terms of, looking at evidence for me to be able to inform you about, I don't think there's any good evidence.
Sure.
There is the Lupron shot with leuprolide acetate, which will kind of shut down your menstrual cycle, and that's what causes the fibroids to shrink. But it's not recommended to be on that for a long period of time because you don't have the benefits of estrogen, which will maintain your
I've done it
bones.
twice and it's awful. I mean, it's going through menopause, really. So
Essentially.
So something Lisa said is absolutely correct. There's the evidence to back up, like I think you hear a lot about like a low estrogen diet. It's inconclusive, and the reason for that is that we all have different estrogen levels, and that's baseline, right? So then when you're dealing with trying to alter that with nutrition, the evidence that we have is based on, when we're trying to test humans, everybody has different estrogen levels, so we can only do so much in terms of clinical trials to balance that out across the board among the, sample that we're testing. So there are some foods that have been shown to increase estrogen levels. There's certainly some foods, like Lisa was saying, that are estrogen blockers because they kind of fight for the same receptors. And estrogen certainly feeds the tumors, both benign and malignant. So if you're for example, there's a lot of studies out right now that have backed up. It's a compound called indole-3 carbinol, and it's found in cruciferous vegetables. So you hear about cruciferous vegetables being anti-carcinogens. And the reason those specifically do well with cervical cancer and with fibroids, because it's the same sort of tumor, it's the cell proliferation and the tumor growth in general, is because they kind of come in and circumvent the estrogen to the receptor. There's a couple other ways that the indole-3 carbinol is I3C, and you can take it in supplement form, but really the best way to get it and the most absorbable way is to eat cruciferous vegetables. That'd be broccoli, cauliflower, cabbage, Brussels sprouts, turnips are in that family also. So it's just, it really comes down to like eat your vegetables, So but I just wanted to point that out because a lot of people are saying avoid soy, and soy is a whole nother thing altogether because of the GMOs and what's happened in the agriculture world in general. But I just wanted to sort of touch on that.
Thank you both. Dr. Lisa?
I think what both of the ladies have touched on is that there's so much complexity to each individual, and so it's oftentimes challenging to find one recommendation that is just sort of a blanket, first step for everybody. From a Chinese medicine perspective, it's a little bit different because we look at each body type and its own unique characteristics. So there may be 3 women, like say on this side of the room, that have fibroids, but your body type and your body chemistry is all totally different. Maybe one of you has, in Chinese medicine, something that may be linked more to what we would call damp, which would mean like a lot of phlegm in the body, very sensitive to dairy, very sensitive to things that would cause excess phlegm. We just kind of have a different system of diagnosis. There may be someone else who's very sensitive to stress and finds themselves, having cycles where there are a lot of clots, or something that we tend to link stress with when it comes to your cycle. And there may be someone else who has fibroids that also has night sweats. And so there you have 3 totally different types of patterns where the overall symptom that you may be seeking treatment for is fibroids, but there are different sort of mechanisms happening in the body from a Chinese medicine perspective. So that's why it's really important to really get to know like your body's symptoms and what may be off for you that you used to find was normal. Like, are night sweats new for you? Are you finding that you're having more gas or bloating because of certain foods? Are you finding that your breasts are more tender than normal? Are you finding that when you're stressed out, your cycles are worse? Because all of those things do have an impact on your biochemistry. So you start to just look at addressing the situation from a holistic standpoint, again, like I mentioned before. So looking out from the layers of what's going on in your body, trying to address some of your symptoms, the common symptoms. Does that make sense?
Can yoga be a treatment?
Definitely. I'm glad that you brought up the word stress. Stress is a contributing factor to a lot of ailments that we have as women. Where yoga plays a role or a part in that is that yoga helps us to de-stress and to have a little bit more clarity. That way we're not focusing on the problem, we're focusing more so on bettering ourselves. And it could definitely help eliminate contributing to fibroids or the growth of them. Like I said, I have fibroids myself. And I noticed that when I started practicing a little bit more, that I didn't have so many of the negative symptoms. My periods were not as heavy, they weren't as painful because I was more relaxed about it. I wasn't stressed out about it, and it definitely helped me in my life. So I think yoga can definitely be a treatment for fibroids or for any other ailments that are stress related. I was diagnosed myself with fibroids when I was 18. It did affect me, but I would have to say that I feel like yoga has definitely helped me be able to kind of deal with it and get over it. I also just had my first daughter 5 months ago. So thank you. I know a little bit about fibroids and how it could possibly have an effect on fertility. But for me, it didn't. I feel like I said, yoga did help with that. And it also did help me with my pregnancy. It was very easy, very smooth.
Yeah, with fibroids in general, you kind of want to do like an anti-inflammatory way of eating. And it's difficult to adhere to, but I think you had mentioned like the mucus, kind of like the damp thing, and that goes for nutrition too. There's certain foods that just produce an inflammatory response. It's almost like they produce an immune response. And dairy is definitely one of them. Sugars, processed, refined carbohydrates. Not all grains are bad. Not all carbohydrates are bad. Just the processed, refined ones are going to produce an inflammatory response. Definitely some proteins. Red meat is a little slower for us to digest, but it has great properties too. So things like that, caffeine, alcohol, those are all big inflammatory response foods.
All the fun stuff.
Yeah. I don't want to bog down
Can we give them all a round of applause? This event is, I guess you could say, a creation of mine because probably like all of you, I've had questions since I started visiting my OBGYN, and those questions have grown progressively as I've matured and had various experiences, and then hear stories from women of all different ages. And I found myself sometimes when I would experience something, I'd go online, like we all probably shouldn't, go to WebMD, and I'd look up something because I couldn't get a doctor's appointment right away, and so I'd say, oh my God, I have that. Or I'd find all of these forums of women very frustrated, not knowing how they could maybe treat certain things at home, or questions that maybe a lot of us have. And so I really wanted this day to be about conversation, about sisterhood and sharing, and lastly, letting you know that you're not alone. Because I think so many times we suffer in silence and we think, oh my God, I'm the only person that's going through what I'm going through. And I think it's safe to say with the number of people who've signed up for this event, it's a need, and women want to know more about what's happening with their overall health.